How can sleep impact your heart disease risk? Stick around to find out because in this video, your favorite cardiology nurse practitioner is going to break it down for you. But first, hello everyone, my name is Ray and I'm a hospital-based nurse practitioner who specializes in cardiovascular disease. If you're new to the channel, welcome. If you're not new, welcome back. In this channel, we like to talk about heart disease, both prevention and treatment, other topics related to the heart, and overall health and wellness. So if that sounds good to you, let's get started. In this video, I want to talk to you about the importance of sleep. But since this channel is all about heart disease, I'm going to tie it in with how a lack of sleep can dramatically increase your risk of heart problems. But I want to kind of just give you a quick background as to when and how I got interested in sleep. Now, I'll be honest, I'm a little bit obsessed with sleep, so I may geek out a little bit when I talk to you about this stuff, so bear with me, please. A lot of my friends and family sort of know this about me that for many years I've been kind of like a grandpa, and I'm typically in bed by like 8 p.m. because my body has just gotten so used to waking up around 4 a.m. now. I wasn't always like this, of course. Gosh, I think it must have been around 2018 or so, maybe even before that. I took a class at the hospital that I work for. It's called The Rest of Your Life. And in this class, they did an activity where they kind of reverse engineered your target wake up time by figuring out what time you have to be in bed the night before. Basically, what you do is you figure out what time you have to leave for work, plan a workout, before you leave, and then plan for an 8-hour opportunity to sleep. So back then, I used to start work at 6:30 in the morning. But I needed to leave my house around 5:30 in the morning, which meant I needed to be in the shower by around 5, which meant if I wanted to get in a 30 to 45-minute workout in, I needed to wake up like around 4 a.m. So um, ultimately, that meant I needed to be in bed by like 8 p.m. So I started doing that. And at first, when I started, it took a couple of days. But honestly, within like 3 or 4 days, it's like my body just made a complete switch. And I think, honestly, I finally unraveled the mystery of my chronotype. Um, but getting back to that rest class, in this class, they gave an example of a patient that had a heart attack, and it was attributed to his high stressful life and lack of sleep. Basically, in this class, they discussed a lot of the detrimental side effects of poor sleep. And around that same time, I listened to a podcast with the author of the book Why We Sleep by Matthew Walker, which, by the way, it's an excellent book. I highly recommend that book. But his book just basically started adding fuel to the fire of my quest to optimize my health and my life. And it solidified my notion that fixing my sleep was probably the most important thing that I could do to accomplish this. So I read Matthew Walker's book, and I highly recommend it, by the way, like I said, because I'm sure this video is not going to adequately describe just how crucial sleep is to our overall health and well-being. But I'll quote from Dr. Walker's book where he says something to the effect of, there does not seem to be one major organ within the body or process within the brain that isn't optimally enhanced by sleep and detrimentally impaired when we don't get enough. I'm going to say that again. So the book is trying to answer why we sleep. That's the title of the book. And, he says in there, again, something to the effect of, there does not seem to be one major organ within the body or process within the brain that isn't optimally enhanced by sleep and detrimentally impaired when we don't get enough. So those are some pretty powerful words. So needless to say, sleep is very, very important. So let's talk about the benefits of sleep. So sleep helps with our immune system, which is constantly in a state of fighting off harmful viruses and bacteria. So people that don't sleep well, they're constantly getting sick. I've had so many patients and even friends and family that struggle with things like seasonal sinus infections. Some of them get several per year, requiring antibiotics for the recurrent infections. And a lot of times, they struggle with sleeping. Sleep helps fight malignancies. It helps fight, it helps with insulin and glucose metabolism. It helps regulate our appetite, which, helps you regulate your body weight by selecting healthier foods rather than eating junk. You've probably heard of people reaching for high sugary coffee and or donuts, for breakfast rather than eating a healthy, nutrient-dense breakfast. This is usually a result of poor sleep hygiene and, rushing into your day. So when we sleep, our heart rate and blood pressure typically goes down, But for example, if someone has something called sleep apnea, which is basically stopping breathing multiple times throughout the night, they instead will have periods of high blood pressure overnight and at times period of elevated heart rates, though the normal is for the heart rate to go even lower than a person without sleep apnea. So normally everybody's heart rate goes down, when they sleep. I've noticed on my Apple Watch and things like that, my wearables, that my heart rate dips down into the 40s, but I don't think I have sleep apnea. But I see this actually all the time in the hospital. When I go to see a patient in the morning, I check the telemetry or the monitor that they've been on overnight, and I can see where patients have had episodes of profound bradycardia or really low heart rate, sometimes even what we call pauses, as well as hypoxia or lack of oxygen as measured by something called a pulse oximetry or pulse oximeter. I've seen oxygen saturation drop down into the 70% range. Just for reference, most people should be in the 96% range unless you have something like COPD or chronic obstructive pulmonary disease, which means you probably live in the 89 to 92% oxygen saturation range. But it's not normal, for people to drop down into the 70s, especially young patients. So that's typically due to something called obstructive sleep apnea or OSA, which literally means you stop breathing in your sleep. This should sound terrifying, like you literally stop breathing in your sleep. And not like once or twice either, it's happening all night. If you have mild sleep apnea, it can happen anywhere between 5 to 14 times per hour. If you have moderate sleep apnea, it could be like 15 to 30 times per hour. And if you have severe sleep apnea, it can cause you to stop breathing over 30 times per hour. So you multiply that by 8 hours per night. Just imagine the havoc that this can wreak on your health. So this condition, used to be thought to be pretty benign, but we now know that OSA can be quite detrimental to your health. The consequences of OSA or sleep apnea range from cardiovascular, metabolic, neurocognitive, and increased mortality. From a cardiac standpoint, OSA can cause an arrhythmia, something called atrial fibrillation, which can cause things like a stroke and heart failure. OSA can affect your blood pressure, specifically something called resistant hypertension, meaning we're throwing multiple blood pressure medications at you and we're not really treating the underlying cause, which a lot of times is the sleep apnea. Now, understand OSA is considered a secondary cause of hypertension. A lot of times you may just have what we call primary hypertension. So if you have hypertension, please make sure you see a hypertension specialist, whether it's a cardiologist or a nephrologist, which is a kidney doctor. Both of those are considered to be hypertension specialists. OSA is also associated with coronary artery disease or blocked arteries in the heart, as well as something called pulmonary hypertension, which is elevated elevated pressures in the pulmonary arteries. Pulmonary hypertension is a specialty in and of itself, and there are certain medications like sildenafil or Viagra that help specifically for pulmonary hypertension. Here's a fun fact for you. Legend has it that Viagra was originally formulated or created for pulmonary hypertension, and during the clinical trials, researchers were noticing that their male patients were oddly having a side effect of prolonged erections. And someone had like a eureka moment and started seeing dollar signs in their eyeballs and started marketing it for erectile dysfunction. So, pulmonary hypertension is a disease in and of itself. The metabolic consequences of OSA include risk of diabetes, glucose dysregulation, insulin resistance, dyslipidemia. For the neurocognitive consequences, OSA can cause excessive daytime sleepiness. I see patients coming into the hospital all the time complaining of being tired all the time. Lo and behold, we see evidence of possible sleep apnea on the telemetry monitor, like I mentioned earlier. Now, it's important to note we can't really diagnose you with sleep apnea in the hospital. We can only tell you that you have some signs and symptoms, and then we will highly encourage you to see either your PCP and have them order a sleep study or refer you to a sleep specialist, ideally a sleep specialist. So there are two different types of sleep studies. There's one that you can do at home and one that you do at a facility with someone monitoring you. If you're the type of person that can sleep in foreign places, like when you go on vacation and in a hotel, you can't sleep, then a home sleep study might be the best option for you. But Keep in mind that a negative home sleep study may not necessarily completely exclude sleep apnea or even other sleep disorders, because the home studies are much more prone to user error. Thus, it might be non diagnostic, or what we call false negative. However, if you're the type of person that can sleep anywhere, then I would highly encourage you to do an in-house sleep study, meaning at a facility, because it's much more diagnostic, meaning the results will be definitive versus the one you do at home, like previously mentioned, may not necessarily be diagnostic. When I was researching the implications of OSA and heart disease for this video, I found a JAMA article, which is a journal of the American Medical Association from 2020, that listed mechanisms like oxidative stress, sympathetic nervous activation, hypothalamic pituitary adrenal axis activation. I'll talk about that more here in a second. Increased cardiac preload and afterload. This is not a good thing, by the way. We actually have medications that target these, appropriately called pre and afterload reducers, which all these things have subclinical consequences, such as elevated blood pressure, like we talked about before, metabolic dysregulation, which we also talked about before, systemic inflammation, endothelial and myocardial or heart dysfunction. The endothelium, by the way, is a layer of cells or tissue, specifically inside blood vessels. So think the inside layer of your blood vessels not working the way they're supposed to, and this can lead to plaque building up in your arteries. The disease endpoints that these subclinical consequences influence are things like, again, we talked about earlier, but just to drive it home, hypertension, type 2 diabetes, coronary artery disease or blocked arteries, which can lead to heart attacks, cerebrovascular disease, which can lead to strokes, arrhythmias, and heart failure. According to the American College of Cardiology, OSA is highly prevalent and often underdiagnosed and thought to affect between 40 to 80% of patients with hypertension, heart failure, coronary artery disease, atrial fibrillation, and stroke. So sleep apnea is just one type of sleep disorder. There are multiple sleep disorders out there, so keep that in mind. And another sleep disorder is something what we call insomnia. You've likely heard of insomnia, but that could be either difficulty falling asleep, staying asleep, or waking up too early. Though it's a different condition than obstructive sleep apnea, the cardiovascular consequences are the same, as are a lot of the other things too, like the systemic inflammation, increased sympathetic nervous system, etc. Insomnia can also cause dysregulation of the hypothalamic pituitary adrenal axis. By the way, this is what we call the HPA axis, and it's our neuroendocrine system that helps us with things like mood regulation, stress management, immune response, secretion of cortisol. Remember, cortisol is our stress hormone. So dysfunction of our HPA axis can even cause things like anxiety, depression, and unfortunately it just becomes a vicious and perpetual cycle. So I hope thus far I've convinced you that improving your sleep is probably one of the most important pillars of health out there. The reason why I think this is so important is because it's something that we are supposed to be doing literally every day of our lives. From a spiritual standpoint, think about it like this. God thought it was so important for us to do that He literally programmed it every single day of our lives. There are very few things that we need to do every day. We don't need to eat every day, though most people do. Some people would even argue that we don't need to exercise every day, and we probably don't, though I think we should be exercising on most days. But even exercise is not something that we need to do every day. But sleep, on the other hand, I think we do need to sleep every day. And a lot of people are not thriving because they lack this vital thing. And oftentimes for years on end, it's just, absolutely detrimental to your health, not only for your cardiovascular health, but the health of so many other organs and body functions like we discussed in this video. So what can you do about it? Well, for one, if you've been told that you have signs of sleep apnea, such as snoring, excessive daytime fatigue or exhaustion, waking up with headaches in the morning, please get a sleep study ASAP. I've literally had spouses tell me that they've witnessed their partner gasping for air or stopping breathing in their sleep. This is a huge red flag, and you definitely need a sleep study stat. A lot of sleep experts recommend stopping using anything with a blue screen like TV, cell phones, computers, iPads, etc. at least an hour before bedtime, preferably 2. Electronics like these can suppress your production of melatonin, which is the sleep hormone, and thus makes it harder for you to get to sleep. So about 2 hours before bedtime, you should probably cut off drinking any fluids because this could increase the likelihood of getting up in the middle of the night to urinate. Just as a side note, if you have this problem, often this is called nocturia. You may want to see a urologist to ensure that there isn't an actual medical reason, for this. But try to cut back on fluids earlier and see if this helps first. About 3 to 4 hours before bed, you want to stop eating to hopefully allow enough time for digestion and avoid reflux symptoms. Digestion is a very intense process and taxing on your body, so eating too close to bedtime could definitely mess you up and make things harder for you. Another big contributor to poor sleep is either too much caffeine or having it too late in the day. After all, America runs on Dunkin', right? Well, if you partake in jitter juice too late in the day, it can certainly be impacting your sleep. The half-life of caffeine, depending on which source you use, is about 6 to 10 hours, which means if you drink caffeine at 2 p.m., by 8 p.m., half of it will still be in your system and maybe impacting your sleep. So probably the best thing to do is have a hard cutoff time, like say no caffeine afternoon. If possible, you also want to try to avoid evening workouts. Now, hear me out. I'm not saying to skip your workout because working out is good for you, but if at all possible, try to get your workout in the morning rather than in the evening. They've actually found studies, they found that in some studies that people with insomnia, early morning workouts actually help those participants with sleep the night of the morning workout. So that's another incentive to get your workout in first thing in the morning if possible. If possible, when you wake up, try to get morning sun vibes. It's been said that going outside and watching the sun rise in the morning and set in the evening, it helps our brain reset our circadian rhythm and helps increase melatonin production in the evening and decrease cortisol, respectively. Going to sleep and waking up at consistent times, even on days off, can also help regulate your sleep. Our bodies love consistency and routine, so same goes for our sleep. That's why it's called a circadian rhythm. And to quote one of the greatest singers of all time, who also happens to be Cuban, by the way, like yours truly, Gloria Estefan, rhythm is going to get you. So, all right, I'll leave the video right there, but I want to hear from you all. Have any of you been diagnosed with sleep apnea or any sleep disorders? How did your experience go when you started the treatment? Comment down below. If you've made it this far, I want to thank you for spending your time with me today. Time is one of our most precious gifts that we can give, so thank you for sharing yours with me today. If you have any questions about this or any video, please feel free to leave me a comment. I read and answer them all, and I look forward to an engaging community. If you found this video to be helpful or informative, please let YouTube know by subscribing to the channel and make sure you turn on your notifications so you never miss when I upload a new video. I want to say a big, huge thank you to all the current subscribers, all 398 of y'all, almost up to 400. Y'all are really motivating me to continue to do this work and make content to help others. Please consider sharing this with the people you love in your life. Together, we can decrease the burden of heart disease one video at a time. While you're here, please consider checking out some of my other videos about what Big Pharma doesn't want you to know about diabetes. I have a video about hormone replacement therapy and how it impacts heart disease. And speaking of women's health, I recently uploaded a video about breast cancer and the risk of heart disease, so check that one out. I also have a video about GLP-1s like Ozempic and Wegovy. I have a video about how to count calories and how to get started with fasting, so make sure to go check out all those videos too. I'll see you in the next video. God bless you.